We've got a couple of other people coming through. Fabulous. Os everyone. We might just wait another minute because it's not quite 5 o'clock yet. So if you need to grab a drink, then please do. I hope my mic's working okay and that the camera and the lighting are all right. Okay, fabulous. I'm just going to turn off my mute because there are a few pings coming through that might be annoying for the session. So, os everybody. Thank you, Nadia, for the introduction. My name's Sheanna Maine. I'm from Brisbane, Australia. I'm a karateka and have been training for about 30 years, and I am that old, unfortunately. I am also, in my day job, an orthopedic surgeon, and that's one of the reasons that Nadia has invited me to speak today, because the Karate Plus series is looking at trying to integrate a few specialties that are external to karate but do dramatically impact on our ability to train effectively. And as a surgeon, I work very long hours. I don't have the time that I would like to train. And so I think part of my orthopedic training has really helped me understand karate, and it has helped me possibly, and I say this with a pinch of salt, but improve my technique without spending quite as much time in doing it at the dojo. So I'd like to share that with you today. For those of you that don't know what orthopedics is, the word ortho means straight, and the word ped comes from the Greek, which means child. And the profession originally started just by the discipline of surgically managing deformities in children. And so to become an orthopedic surgeon, you have to do a degree in medicine. You then do several years of training in general surgery, and you subspecialize in orthopedics. And then you get qualified as an orthopedic surgeon, but you then do more training on top of that. So my subspecialty interest is in pediatric orthopedic surgery, and we manage a lot of limb deformities and leg length discrepancies. So we grow bones and we correct angulated bones. And it's all very interesting because that relates a lot subtly to what we do in karate. And it's really an honor to be able to combine my two greatest passions in life. So, of course, aside from my child and my husband, but that goes without saying. I'm very used to lecturing doctors, and I'm used to teaching a karate class, but please forgive me because I've never done a karate medical lecture before. This will be pretty theoretical. A lot of what I have to say is not going to involve much physical work. And I think the most important thing to do today, or that I'm trying to do today, is to help you think a little bit like an orthopedic surgeon and try to analyze your own technique and your own biomechanics to work out what elements of your training you can best improve to generate better technique quickly. So please sing out and let me know if I'm speaking too medically, because I really want you to understand what I'm talking about, and medical jargon and lingo can sometimes be confusing. And also, I'll have to acknowledge that I'm still recovering myself from a couple of knee reconstructions and also from a cesarean, which, albeit was 3 years ago, but my training with COVID has slackened off a bit. So I'm apologizing for that now. Hopefully I'll be able to demonstrate what bad technique can look like and how to fix it. So on that note, it's an honor, and thank you, Nadia and Martin, again for letting me teach this class today. I think 2 years ago, none of us would have imagined we'd been in this situation, and it's really humbling. As in Australia, we are very, very blessed and very, very lucky to not be affected to anywhere near the way that the rest of the world has been. So if you are from an area which is struggling at the moment, our hearts go out to those of you in India, in Nepal, in Europe, everywhere that is having to deal with family deaths and the very intense grief that comes with that. I hope that we can keep this group as a place where we can have some solidarity and support, and it's amazing what Nadia and Martin have created here. So let's start by talking about posture and good technique. So I'm gonna have to kneel here because I've set the camera up so that you can see me when I'm standing. The first thing I want to talk about is our perception of what constitutes good technique. And from a biomechanical point of view, purely, we tend to associate good technique with people who have a very good core posture, level pelvis, and are able to integrate the elements of stillness and relaxation into their technique, as well as that gift of speed, and most importantly, the element of kime, which is a fairly unique attribute to martial arts, although there are elements of it that do apply to other sports. So each of those things is really a lesson in itself, and we'll start with posture here because that's something that a lot of other instructors have discussed and have talked about. But I'd like to go into a little bit more detail and be a little bit more critical about our own postures and what we can then do to help support our technique. So we'll get you all to stand up, and hopefully you're wearing some snug fitting gym gear because it's very hard to appreciate poor technique in a dogi. A dogi hides a whole heap of little errors that may then go on to contribute to your development of injuries. So on standing, when I see a patient for the first time and I do an examination, this is exactly what I do. I'll get them standing facing me and I'll have a look at them from the front. And I'm an orthopedic surgeon, I do mainly lower limb surgery, so I'm looking mainly from the waist down. And I'm looking to see if, firstly, they have a level pelvis. Now, some people in the frontal plane will actually have one leg that's shorter than the other, so they'll actually have a little bit of a tilt like this on their pelvis. Very common in the population to have a leg length discrepancy. If it's less than 1 centimetre, it's not anything to worry about. But we stand with a level pelvis in the front, and then I'd like you to see, if you can see my feet there, if I stand with my feet together, take a look at what your knees do. If you're able to access a mirror or stand in front of a mirror, now's a really good time to do it, because it's hard to appreciate this looking at yourself, looking down. But if you look in a mirror, there are some people that stand with what we call bow legs, or knees that sort of are apart from each other when the feet are together. And bow legs are something that we refer to in orthopedics as varus. So that's when you have a little gap between your knees. The opposite of that, okay, there are some people that stand with knock knees, and this we refer to as valgus. And the reason that we look at this is because the angle that your leg has in relation to the ground will alter the force distribution of weight through your knee joints. So if you stand with knock knees, you'll get more weight going through the outsides of your knees. If you stand with bow legs, you'll get more weight going through the inside, all right? It's very important to look at foot position and posture, okay? So there are some people that stand with feet that naturally point out. There are some people that stand with feet that naturally point in for them. And that relates to the overall rotational alignment of the leg. I'll go into that in a little bit more detail later. If you turn to face the side, okay, I really want you right now to make yourself look as unattractive as you can in the mirror and relax. So I want you to see what your natural posture wants to do. Because when you're not in the dojo and thinking about it, this is what your body wants to do when you're at work, when you're running around after children, when you're not thinking about your biomechanics. And so many people have what we call an anterior pelvic tilt, where the pelvis will tilt forward, okay? And the back, as a result of that, will arch, okay? We call this a lordosis of the lumbar spine, that curve there, okay? If the pelvis tilts forward, the more you have to arch your back to get it straight. So do what feels natural for you. Feel how much tension exists in your core muscles, because there's probably not much, particularly if you've had kids, ladies. And then also feel what your hips do and what your knees do. I notice that naturally, I've had 3 operations on my right leg, I will tend to bear more weight on my left than on my right. My balance is not even. So from the side, that's just noting your basic core posture. Then what I want you to do is try and correct that. Now there are a couple of ways. If you do tilt forward, you can correct it by tensing your abs, which pulls your pelvis up. You can also contract your gluteal muscles, which pulls the back of your pelvis down. That's something that sets our pelvis ready for our techniques. And I want you to be hypercritical, okay, about it. So really feel, even if you're not seeing it, try and feel what it is that your pelvis is doing. Sometimes, and blokes in particular, have a tendency to tilt the other way. they'll tilt backwards, okay? So the posterior pelvic tilt can happen when you have really tight glutes and hamstrings. And that's one thing, even if you work a lot on your abs, if you have tight abs, then that can cause the pelvis to tilt posteriorly. And that's something that, again, can place a bit of pressure on your back and can change the alignment of your thoracic spine to your pelvis, which is actually a really important thing as well. So once you have an appreciation of what you need to do to generate a level pelvis, okay, then we can talk about the issues that we face in using that during technique. On a side note, the reason that we want a level pelvis in karate is because I happen to have a pelvis here with a couple of limbs. If we're looking at force generation in technique, ideally we want the muscles of our legs to be able to transmit through our body, through our core and through our trunk into our fists. That's the whole idea of being able to execute the most biomechanically effective punch we can. And in doing that, what we want to be able to do is convert rotation in the pelvis to forward motion of the punch at the end of our wrists. So as we generate that forward motion, okay, it's useful if the pelvis is level. As soon as we start to tilt, now when we rotate the pelvis, there is a diagonal force vector that takes away the energy of that anterior translation or that forward movement. So if we can keep a level pelvis, that's ideal. We can't if we're using Zenkutsugachi. I'll show you why in a minute, but we want to strive to be there if we can. Boss? So now what I want you to do is this little exercise with me, where standing on the side in the mirror, if you can, I want you to step 1 foot forward, okay? And in stepping your foot forward, I want you to see what happens to your pelvis. Now, some of you may struggle even standing with a level pelvis, in which case, just try and keep it as level as you can. As soon as you find that you start to really have to work to keep it level, this is what I refer to as a zone of failure. So the comfort zone, okay, zone of comfort is where you're easily able to keep your biomechanics ideal for the techniques we're trying to execute. As soon as you step your foot forward a little bit and you feel that stretch in your hip flexor, you feel your stomach really having to work and your glutes having to work to keep it level, that's a zone of impending failure where you're starting to have to induce compensatory movement to apply the technique. So what I want to do is, just for you personally, you want to see where your zone of failure transitions into this compensation zone. So for me right now, okay, if I'm true and keeping my hips dead level, absolutely shomen, I cannot move my left leg forward now without my hips starting to tilt. And this clearly is not a Zenkutsugachi, okay? But it's where I'm starting to feel that my body won't allow me to do what it needs to do to make a full-blown Zenkutsugachi. So now what I'm going to have to do is I'm going to have to start compensating in my technique in order to get there. You'll note my back foot is still facing forward, front foot is still facing forward. So now what I start to do as I start to go into a Zenkutsugachi is I start to twist a little bit and I open my pelvis a little, even though I'm still technically at shomen. As I step forward into a proper Zenkutsugachi now, all right, I'm really feeling it down the front of my leg, I'm feeling it down the inside of my knee, and I'm starting to arch my back because my pelvis is now on about a 15-degree angle down. And while I can do Zenkutsugachi here, all right, if you have an injury in your hip or in your back, you're going to struggle and you're possibly going to make it worse by continuing to force this movement. So understanding what your injuries are and what your compensations are in performing your technique is really important, because you may have to sacrifice your technique to protect your injury for a portion of your training if you're recovering. Okay, so try it on one side, then turn around and try it on the other. So some standing into Zentai, step that foot forward, a little bit, now I'm starting to lose it here. Okay, your sides may not be symmetric either, so make sure that you understand exactly what happens on each side of your body. I'm starting to have to twist my back foot out a little bit now. Okay, I'm still going down into Zenkutsugachi. But here, okay, I'm struggling. In order to get my pelvis around, I'm really having to arch my back. And because the range of motion in our hip joint is actually usually only about 30 at the most degrees of extension, that's really normal to have to do it. I'm going to show you this, and I'm going to discuss a little bit of hip anatomy while we're at it, because it's important that you do understand a little bit about how the hip works. So the hip, it's a ball and socket joint. This is a pelvis. The socket is the cup that the ball sits in. Ball sits in there nicely and swivels, all right? The joint surfaces are lined with cartilage, and the joint cartilage is like that shiny white stuff on the end of a chicken drumstick. Okay, that's the cartilage that wears away when we develop arthritis. Now, joints are held together by ligaments, and ligaments connect bone to bone. And so all joints have this thing called a capsule, which contains the joint, and it provides the lubricatory fluid, the synovium, that allows that joint to move freely. When that capsule becomes tight, that will limit our range of motion. But the other thing that will limit our range of motion is the actual anatomy of the joint. So it's impossible for this hip joint to go any further back than about 30 or 40 degrees. And those really flexible gymnasts that you see may get a little bit more out of it when they're young. As we get older, the ligaments tighten. It's really hard for that joint to remain as supple as it was in our youth. There are some people that have hypermobility syndromes. For them, their ligaments do allow the joint more movement, but as a result of that, it's possible for the joint to be injured as well. So flexibility and hypermobility is a very, very difficult thing. People who are hypermobile do need to work on strengthening the joint so that they have control over the joint and don't incur other injuries as well. So that's ligaments. And the tendons and muscles, they cross the joint and move the joint around. The hip in particular is important because it has an extension to the cup with a bit of what we call fibrocartilage, not the same as the joint cartilage, but fibrocartilage which encloses that ball and holds it in. It's called the labrum. And for us in particular in martial arts, that's a really important structure because doing high kicks can damage the labrum, and that can be a source of injury and hip pain. So just summarizing that, joint anatomy is important. The wonderful and beautiful thing about orthopedics is that our bones are as different on the inside as our faces are on the outside. There are no two skeletal structures that are identical. And even twins who've been through different, nature and nurturing experiences can have slightly different skeletal structures to their bones. The impact of that is that we cannot expect to all have what we classically describe as beautiful, perfect karate. And in my mind, karate is about function. It's much like orthopedics. It's about being able to generate the maximum power out of the body that you've been given, whether that's an injured one or not. So it's very important to not inflict a biomechanical criteria on a student or even on yourself that limits or prevents you from achieving that. And some of the maxims that we often hear from our instructors do verge on doing that occasionally. Now, I'm not saying don't do what your instructor says, absolutely not. You have an instructor, you absolutely do what they say. But be aware that if something is not working for you, there may be a reason for it that is not a lack of you trying. Us? So on that note, we've just looked at Zenkutsugachi, had a little look at Tilt, and what I want you to do is now try this with Kokutsurachi, because Kokutsurachi is a really interesting stance. Kokutsurachi, we're going to start with our feet, one at 90 degrees and one pointing forward, and we're going to try and find that zone of failure where our body is stopped from being able to do what we want. So for me, this doesn't take very much. With my left foot pointing forward and my right straight ahead, I slide my right foot out, and then Kokutsurachi, obviously we have to drop, okay? And this is the critical thing. As we slide our foot forward, we want to try and keep that pelvis level, and we try to keep our back knee out, okay? Externally rotated, that's one of the things that we try to do. At the same time, we slide our foot forward, okay? But at this point here, I am really struggling again to keep my pelvis level. all right? And what a lot of us try to do is externally rotate or bring this leg out so that the knee is over the toes. And what that does for me is it shifts my hips into a more flexed position. And as to compensate for that, I have to then try and extend or curl back my lumbar spine in order to do it. It might be easier for you to see this way. But if I try to bring my knee out over my foot, I can't do that without tilting forward. And then this happens. And a lot of people really struggle with keeping your butt in Kokutsurachi. The reason for that, one of the reasons for that, it could entirely be a lack of strength on your part, and that is fixable. But the other reason for that is the rotation of our bones. So, like I said, our bones are all a little bit different. I'm not sure if you can see. I'm going to drag my box over here to you. I've got two femurs, thigh bones, sitting on this table here. And what you can see here, they've got a ball at the top end. This is the knee joint down the bottom. And what I want you to do is imagine that you've sliced this bone like a salami down the bone shaft. I'm going to lie them on the bone shaft on the table here. And I'm hoping that you can see that with both knees pointing exactly forward, the ball of this femur points a little bit more forward than the ball of this femur, okay? And we refer to this as the version or the angle of the femoral neck. And it refers to it, in effect, the rotation of the femur, the amount of rotation of the bone that's present. Now, when someone's femoral neck is excessively anteverted or it rotates forward more than perhaps what it should, this manifests in a number of ways. And some of you may be aware or have children that sit in the W position like this, okay? You cannot do this as an adult routinely unless your femoral necks are a little bit pointed forward, a little bit anteverted. And the other thing that can also happen is that the tibias, which are the lower bone, okay, this is our leg again, the tibias can sometimes point externally, okay, so they can point outwards. And the effect of this is to give you a limb that doesn't quite rotationally work as well as it should. And it predisposes, if you have a little bit more femoral anteversion, it predisposes the knee from doing what Sensei Rachel and Sensei Lauren have tried to instruct that we shouldn't do. It allows the knee to fall inwards. This, you may remember, we started off by saying is a position of valgus. Now, when it falls inwards as a result of the hip, it's something that occurs during motion, during walking, during running or jumping. It's called dynamic valgus, and it puts you at risk of things like ACL injuries. And I can say that because I've got it and done 3 of them. So when you have this rotation occurring, it impacts your stances in a very, very significant way. And it doesn't take much. The usual amount of femoral version is about 15 degrees upwards. But when we're born, we have about 40 degrees of anteversion, and then it usually comes down to 15 as we mature. So if you are somebody that has a little bit of persistent anteversion, what that means in your Kokutsurachi is that, for instance, I've got a bone here, this is my femur, and I'm able to rotate it. Can you see that? When we put that femur into the pelvis, like that, with the head aligned with the knee like it should be in a normal stance, the knee points downwards, and it's easy for the person to get their knee out over their foot. If now I rotate the femur so that its neck points forwards like this, in order for this femur to fit into the pelvis, the whole leg has to twist. And now you're in a position where the knee naturally turns inwards. So asking a person that has this issue to get the knee out over their foot makes it much more difficult for them to achieve what we would say is biomechanically efficient for them, efficiency of movement. They're trying so hard to get their knee out that in fact they're using compensatory mechanisms and muscles that are going to detract from the technique. So I'm hoping that this is making sense. When you're doing your Kokutsurachis, be aware that trying to keep your hips level is probably more important, and having that strength in your hip more important than the position of your knee from a purely biomechanical point of view. I'm not saying don't try to get it out, because in that process of getting that hip out, you activate your glutes, which is really important and the foundation of your stance. But doing this at the expense of your power and your strength and your speed is something that you need to be aware of not to do. Okay, what's the time? I'm almost running over time here. The final stance that we'll talk about today is Kibadachi. And again here, rotation of the feet and of the knees is really important. So rotational alignment of the leg needs to be something that you try to be aware of in your biomechanics. And likewise, keeping that level pelvis so that we can achieve a stance that is balanced is important. And it was lovely to hear, I think it was Sensei Rachel the other day saying it was okay for your knees to sit where they need to sit to achieve that strength and stability in the stance, and I'll just echo that today. Okay, I've been doing a lot of talking. What I'd like to do now is go through a little bit about what you can do when your student or your body doesn't seem to be working the way you want it to. And I might just, I'll give you a minute to grab a quick drink. We've not done much, but I certainly need to grab a quick drink. So just 1 minute and I'll be back. So moving on from that, what I would like to do is just go back to anatomy for a sec and talk about the things that prevent us from doing what we want to do well. And I thought I'd just use one point in case from karate, being the lifting heel. And this is obviously something that is the bane of many of our existences. So what I'd like you to do is, from Shizentai, just come back down into your Zenkutsugachi and make it a proper Zenkutsugachi. Accommodate your body and make sure that you do the best stance that you can. And I'd like you to feel the pressure of your heel driving down into the ground and feel what your body is doing to get it to push, okay? So we might just hold a Zenkutsugachi stance isometrically for 10 seconds, and I want you to feel the pressure of your heel driving as hard as it can into the floor. If you're a person that struggles to get your heel down, I want you to shorten your stance until you can actually feel that pressure driving through the floor. And we're going to hold it there, okay, for ich, ni, san, shi, push down hard, ruk, sich, hach, kyu, ju. And if you're doing it correctly, you should be feeling this, not in your calf, but you should be feeling it in your glutes. And a lot of people think that they have inflexible ankles. Well, if you are able to push your ankle probably about 5 centimeters away from the wall and then touch your knee to the wall, then you do not have a problem with flexibility, okay? What you may have a problem with is strength. And a lot of the time we lift our heels dynamically during movement because our glutes are not strong enough to activate and hold that heel to, or push that heel to the floor at that moment that we're driving through to do the technique. So strength, flexibility, control, neuromuscular control is something that's also been talked about a lot, but that's the ability of the brain to activate the muscle patterns that you need to do the technique you want to do. And so neuromuscular control involves all the small muscles of your hips that balance your pelvis, the muscles of your core that generate that rigid structure which your arms and limbs can work off. And then the final thing that you may have a problem with is that of endurance. So when you're analysing the failure that you're perceiving of your technique, you want to be thinking about these 4 things. Is it a strength problem? Is it a flexibility problem? Is it a control problem? Or is it an endurance problem? Endurance is easy. So if you're able to do the technique for the first 5 minutes of your class, but then you find that your technique falters at the end, there's something going on that's stopping you from maintaining that, and it's probably a lack of core endurance. That's the main thing that people tend to falter with. If you're struggling with flexibility, you'll find that you're not actually able to do the stances in slow motion or in basic training slowly because you don't have the physical ability to get yourself there. If it's a strength problem, you find that it is a dynamic thing usually where you're struggling to actually provide power to those movements. And you can get the heel down in stance, but you can't keep it down. And the neuromuscular control thing is really tough. That's probably where the majority of us struggle with our development of technique. And that is, as we say, that's just practice. So in order to work on some of these elements, what I would like to do with you today is just take you through a few of the exercises that we would do prior to the World Cup in 2016. And I want to try and work on them purely from a karate perspective. And Sensei Lauren has already done a lot of this stuff with you, but I think what I would like to do is try and look at it from an orthopedic perspective and help you understand why, from a biomechanical perspective, we do what we do. So what I'm going to do now is discuss something called the kinetic or kinematic chain. And the foundation of sport or any activity involves the principle of the kinetic chain. So what this is the concept that we have our bodies as a series of linked segments. So the foot segment, the shin segment, the thigh segment, the pelvis, the core, the shoulders, the upper arm, lower arm, hand and wrist. And the movement of one segment will affect the motion in the other segments adjacent to it. That's very basically what the kinetic chain is. The reason that our bodies work this way is to achieve efficiency of movement. And so when, for instance, we are walking is possibly one of the most efficient things that your body can do. All we do is we fall forward, so we shift our center of gravity forwards, and our leg steps out to catches. Now at that point in time, okay, you can see the hip is a little bit bent, the knee is a little bit bent, and the ankle is a little bit bent. As we keep transferring our weight forwards through no muscular effort of our own, really, other than to maintain stability, our hip straightens. The fact that we straighten our hip causes our knee to straighten, it causes our ankle to straighten. And that process is a beautiful and elegant demonstration of what the kinematic chain refers to. Now, if we take that and apply it to karate, the very same principle exists. When we're moving forward in Zenkutsugachi, you can try it yourselves. We have a bent ankle, a bent knee, and a bent hip. If my left leg is my driving leg, as I step through, the hip straightens, the knee straightens, the ankle actually flexes a little bit more because I'm trying to keep my heel down. But if I want to generate maximum movement and maximum power, as you would in kumite, then I lift the heel, okay? And that gives me a little bit of calf power, which I can then use to propel forward as well. So it's all about generating maximal acceleration and speed in that forward trajectory, and we're transferring it from our legs through our torso into our fists, okay? So in doing that, strengthening your kinetic chain, strengthening those moments in your legs are going to give you an equivalent benefit in what you do karate. And the most basic form of strengthening that we can do to all of these segments is the squat. In saying that, I'm not going to start there because what I want to do is just work a little bit on warming you up, getting a bit of activation into these muscles, okay? And one of the nicest ways that I find to activate is using a Swiss ball or even a chair or a bench if you've got it. If you can try and find something to balance on where you're able to get into a lying position and holding your hips up using your glutes and your hamstrings. So if you're able to find a chair or a ball, please grab it. And what I would like you to do is sit on the ball, just come forward. If you want to make this exercise harder, then grab a weight. But I want you to roll forward on the ball until your shoulders are on there. And I want you to just elevate your hips up so that you are using your glutes and your core to hold yourself level. Now, I'm hoping that most of you online, particularly those of you who are experienced karateka, should be able to do this pretty easily. So what I want you to do now is take one foot off the floor, okay? And try and hold it there for 15 seconds. 14, 13. Now you'll find that your glutes will start to activate. They'll start to really have to work in addition to your core muscles having to work. Try not to let your hips sag down. Keep them up. Oh, touch the floor and relax. Now other side, okay? 3, set, go. Lifting up your other leg. Now this is my weak side. I really struggle with this side because my right leg, since the age of 19, has really not rehabilitated well. So I'm keeping my left leg up as best as I can. I'm feeling my hips sag a little. I'm trying my best to keep my pelvis level and keep my torso nice and taut and strong. And if you want to make the exercise harder, what you can do is provide less of a base for your back and upper back to support on, and you can lift your hands towards the air and start to wiggle them from side to side during this activation exercise to really turn your core muscles on and start your body working together. Okay. The next thing that I'd like to go through is one of probably the most important exercises for those of you who struggle with knees. And knee pain, or any limb pain for that matter, what it does is it switches off all your supporting muscles. So trying to keep them active is really important, and particularly when you're doing your rehab, you'll start off by doing some very, very basic stuff. Basically really boring exercises where you're just breathing in and out. But if you're anything like me, you struggle to do that stuff. I'm gonna go straight to the bar and demonstrate the hip thrust. Now, if you have not got an Olympic bar, obviously we don't all at COVID, just get a weight and pop it on your pelvis. But the idea is to be sitting on the ground, bar across your hips, and then lifting the bar up with your knees bent. Now the reason this works is because your knees are bent. You're not using your hamstring muscles to move the bar at all. All you're doing is lifting the hips up, which is purely a gluteal exercise. There's a little bit of back involved as well. But if you can really weight up during this exercise, we were training for the World Cup. I'm not particularly strong. We were doing 90 kilo hip thrusts. Some of the girls from the Australian Institute of Sport, the netball team, they do 200 kilos. It's something that you really can't do too much of to improve that gluteal strength. The next exercise that we would do is the squat, and we will talk about the squat a little bit as it relates to injury, because like I just told you, all those little biomechanical things that you may find in your bodies, they do impact your ability to do good technique with your weights, and it's really important to know what to look for to best improve your karate. So with the squat, okay, as Sensei Lauren has said already, you want to drive the hips back. So the reason that I'm focusing so much on hip drive is because at the end of a Zenkutsugachi, when we're moving through, okay, for Oizuki or for a Gyakutsuki, when we're doing that, okay, it's that final bit of rotation and that final bit of hip extension that gives us that ability to kime and that final bit of power. And we need to be able to really lock that hip out, so when we punch, or if we're doing it in kumite, we've got that stability and control there at end range of movement. So there is no point when you're squatting to come up to a position where your hips are actually not straight, okay? Really what you want to do is come down in your squat and then use your hips to drive you up, rather than thinking about straightening your knees. And it's a very subtle difference, but for someone that does have knee pain, I can tell you that if you employ this when going up and down stairs, it makes the world of difference once you get the hang of it. And it really does stop that anterior knee pain that you get when your muscles stop working properly. So I'd like you to try that just with me 10 times doing a squat. All right, so we're going to go feet are shoulder width apart, hands just resting in front. I'm going to go really slowly and explain what you're doing at each step of the movement. So we're going to go down. First movement, flexing at the hips, hips pushing backwards, knees bending, hips going down, keeping your core switched on so your pelvis tucked under. As soon as your core loosens, your butt sticks out. We don't want the butt to stick out, we just want the hips to drive backwards. Okay, and now this is a really important thing. Once you're down, don't think about straightening your knees. Think about driving forward with your hips. And that will get you up, and hopefully you can feel that the pressure is taken off your knees when you do that movement. At the same time, obviously, you want to maintain your good core posture, spinal posture, keep your head and your shoulders retracted, so don't let them fall forward. Just a couple more, so we'll do 5 times, and I really want you to feel that you're taking pressure off your knees with the squat. So each, drive down, now straightening the hips, don't think about your knees, straighten the hips. Knee, down, and up, sun, down, up, chi, down, up, go, down, and up, os. So obviously, if you can do a body weight squat pretty easily and you're starting to understand that patterning, that neuromuscular control that you want to develop, then you can start loading up the weight. And there are so many different ways of doing this, so many different trainers that you can speak to, and so many different physios that have a way of doing it. Find someone that you trust, stick with them. They are really good, really well educated in this sort of stuff, and I would certainly go to see one of my colleagues about how to develop a program that might rehabilitate my leg or help me deal with another injury or problem with my training. One of the next exercises that I want to try with you guys is a Bulgarian. And this is a really, really good exercise for doing all of those things that I mentioned. For those of you that don't know, a Bulgarian relies upon having a single leg bearing your weight. The other leg is tucked up behind you, okay? And then as you go down on that one leg, again, you're trying to keep the pelvis level. The reason I love this exercise for karate is because you're working on the control and the stability of the weight-bearing leg. You're getting a beautiful stretch down your hip flexor, which we often don't get to achieve. And it's working on that balance and control in your glute. So again, this is like a squat. You want to drive up using your hip, okay? What I find happens to me is that my pelvis tries to rotate. So I'm trying very hard to keep my hips forward, exactly like we would in the Zenkutsugachi. So we're going down, really feeling that stretch along the front there, and up, knee, and up, sun, and up, chi, and up, go. And if you keep your hips forward at this point, I'm hoping that most of you really do feel that stretch down the front with your rectus femoris, your quadriceps, and your psoas. So changing sides, we might as well be symmetric. Other side, stepping forward so that you're feeling just a little bit of a stretch to start with. Itch, and up. Oh, this side's not as good. Knee, sun. Again, trying to keep your pelvis level the entire time. Chi, up, go, up. Okay. 2 more exercises that I really love and I think relate to karate well are the throwing step up. And this is beautiful because it's one of the few exercises that I feel really relates to a Gyakutsuki and the creation of Kime. So Kime is hard to define from a biomechanical point of view. But what I feel best describes it is that ability to lock all of your muscles, core, legs, everything instantaneously, and and then have it relax. But the thing that we need to also appreciate is that when we go back to our kinetic chain, that process of generating force and acceleration starts initially at the pelvis, and then the next segment, okay, the segment distal or below the one we're starting the activation movement from, has to release at the point when the speed and acceleration of the first segment is maximal. And studies have been done if you look at tennis players generating speed and power through a serve, same principle. If you apply it to a punch, what that means is that your hip rotation, okay, your hip rotation has to start and immediately flick, at which point your thoracic rotation, which really there shouldn't be much of because you're not using your thorax to generate movement, but your thoracic movement mirrors that of your hips and releases your arm at the point at which your hip rotation is has the most power. If you have a break in the kinetic chain, so for instance, you finish your hip rotation and then release the punch, which many karateka do when they're learning, that's when you lose power. But the same thing might be said that a lot of the time we do have that initiation with the hip and the punch fails to end at the same time as the hip rotation ends. So while you have to initiate with the hip, the best way of thinking about that kime is to finish the technique of the hip and the punch together. And because the whole thing happens so fast and we're not thinking about the kinetic chain when we do it, it's something that your bodies will automatically again do with practice. But back to the throwing step up. What this does is it helps us activate the muscles that we need to in a rotational perspective. So if you have a weight, okay, I want you to stand in a Zenkutsugachi facing either a chair that's got some sort of back behind it, like place your chair against a wall or place a bench against something solid, because what we're going to do is we're going to start with the weight, level pelvis, engage core, and we're going to step forward and throw the weight rotationally around us, okay, and then come back. And what this does, if you can imagine that the weight is like a gyakuzuki, is it starts developing us or helping us develop that control at the end of that motion. So, sorry, just getting a few questions coming through. When we do this, we want to practice on driving through that back heel, using our glutes to get forward at the same time as throwing the weight as hard as you can, safely, to your opposite shoulder. And so it should look something like this, okay, where you're driving through that heel and landing with your weight over the top of your shoulder. So if you can, remove this bar, we'll try that 5 times. You might find that you're a little bit uncoordinated to start with, which is fine. That's the point of this exercise, is to start using your muscles together to generate that coordination that you need to throw your gyakuzuki and have it land perfectly. So just slowly, we'll do 5 slowly and then we'll go a little bit faster. Itch. Okay. Knee. And back. Sun. Shi. Go. Yes. Other side. Okay. So I've just got to work out which way around to do it. Starting on your left hand side with the weight, stepping up with your right leg. Itch. Knee. Sorry. The box moved. Sun. Shi. Go. Okay, so now a little bit faster and harder, okay? If you can drive through that back leg and create some distance, then that is something that I want you to try to do. If this is the first time that you've done this, don't stress about it. just get the movement patterning right. So this is my weaker leg, so I'm going to be going carefully. Ich, ni, san, shi, go. Okay, other side. Left leg forward. Stepping up with the right leg. Ich, ni, san, shi. Last one. Go. Okay. So, I've got 10 minutes left. What I wanted to try and do is go through a little bit about how we can modify a technique in the face of injury. One of the things that I want to do before that is just do a little bit of a explanation or a example of some of the exercises we can use for core stability and control. So, if you're fortunate enough to have a partner at home, then you can use this exercise and do it together. And if you don't have a partner at home, like me, just find an object that is fairly sturdy, okay? And if you can tie your elastic around it, that's great. So, what I want to do is, again, work on core stability as it pertains to karate, which for us is a lot of rotation. So this is called a pal-off, or it's a variation on a pal-off. And a pal-off is an exercise where you usually have a weight that is pulling you sideways, and you're trying to resist the weight either in rotation or isometrically by going up and down with your hands. If you have a partner, what you have to do is turn to face the other way. One of you has to turn to face the opposite direction, and then you can both hold that weight or the elastic and twist. So what I'd like you to do is just feel, even just putting a bit of tension on that elastic, feel the way that your core has to act to hold yourself there, and be very conscious, very, very conscious of not raising your shoulders, okay? So keep your shoulders down, nice and relaxed. This is not an exercise on holding your arms up. This is an exercise on keeping your trunk steady. And you can do it, if you like to keep it easy, on 2 legs kneeling. If you want a bit of a challenge, you can go onto 1 leg kneeling, okay, which is very, very relevant to karate as well, because we're always 1 leg forward. You can go from a lunge position, or you can stand up and do it, okay? I'm going to adopt the lunge today. So you're going to grab the elastic on one side internally, have enough tension on it that you have to work to hold yourself level, and then I want you to just twist side to side and keep everything absolutely still other than that rotation of your upper body and your trunk. So if you can get yourself set up, give you a minute. Okay. If you're finding that one of you is a big person and one of you is a little person, it might be better to just go to a stationary object. And the idea is not to pull your partner over, the idea is to try and just feel that tension in your core muscles. Again, keep your hips level, core engaged, shoulders relaxed, head pulled to the roof. All the things you would try to do with normal good technique. Slowly ich, twist, ni, twist, san, shi, go, rook, sich, hutch, ki, ju. Good. To do the other side, what you'll have to do is turn around and face the other way. Okay? So I'm going to do it facing you so I can see you. Other side. Ich, ni, san, shi. Be very aware not to tilt as you get tired. Go, keep it upright. Rook, sich, hutch, ki, Ju. Yame. That's cool. So, only 5 minutes left. I had a whole section that I wanted to talk about with regards to hip injuries, things like arthritis, labral tears, knee injuries, ACL reconstructions. We've touched a little bit on that. With hips in particular, one of the things that damages the cartilage around them that unfortunately we are prone is the fact that we do high kicks. And I've damaged my labrum, my hip cartilage by trying to do very fast and relaxed kiages, and in partial just tore the hip cartilage as I was doing that motion in what I was trying to do, improve my technique. So just on that note, one of the things that you can do if you do have hip problems, firstly, again, seek the advice of someone who's experienced and get appropriate investigations done so that you know what you're dealing with. But in karate, one of the problems that we have is that anterior tilt, because what that does is it closes down the front of the hip joint. I'll show you again. Okay, if you can see on the side there, with the hip nice and straight and the pelvis level, the hip is nicely aligned. As soon as we tilt that hip forward, okay, what happens when we try and raise our legs is that the front of the femur here hits the cartilage that surrounds that hip joint, the labrum, and if you do that enough times, you tear the labrum, and that is really, really difficult to deal with and may require surgery. So if you raise your foot, if you can try and keep a level pelvis, one of the things that you can do as you raise your leg is to alter the position of your pelvis to protect that labrum. And that is tricky to do, but what it means that you have to do when you raise your leg to do the kick is really be aware of tucking that pelvis under. So instead of keeping the pelvis level and raising the hip like we normally would, you want to really drive, bend the knee a little bit if you have to, but drive that pelvis under, and it'll just give you that little bit more room in terms of protecting that cartilage as you go to do whatever kick it is that you want to do. So that's one of the things that you can do. Knee injuries, knees are tough. And again, whenever you do an injury in the lower limb, you've got to rehabilitate all the segments of your body, all the segments of your kinetic chain. So it's starting at your core, improve your hip control, really work on your hamstrings and glutes, because most of us are quads dominant in karate. We will preferentially use our quadriceps as opposed to our glutes to strengthen or to straighten our leg. If you can take the pressure off your knee by using your hip to move rather than your knee to move, then that will give you some relief in terms of your pain, dependent on whether your pain is from a ligamentous problem or whether it's from arthritis or any other cause. That's obviously something you need to discuss with your professional. 2 minutes. In summary, I guess what I want to say is be aware of your resting posture, number one. One really good thing or trick that I've learned is be aware of how you sleep, because often your most comfortable position that protects your joints and may also contribute to part of the problem, but it protects your joints, is your resting posture. And I know I like to tuck my legs up and I'll sleep, on my side. It's one of those things which can just let you understand a little bit more about your body and what your body wants to do without you having to think about it. Analyze the reasons for any problem that you may have in your technique and try and work out whether it's a problem with strength, problem with flexibility, whether it's a problem of neuromuscular control or endurance. And if you target that in a program that cross-trains against your karate, you will find that firstly, you're less likely to injure yourself by smashing yourself doing training that is possibly reinforcing a poor technique rather than correcting. And you'll find that your technique improves faster. And the final thing is, please understand your injuries. Make sure you see someone that understands them and understands karate, and make sure that you train to protect them. Thank you very much, guys. I think that's it. I'm just going to see if I can scroll through the comments here, and if anyone has any questions, please feel free to ask. Oh, yep, Thomas Meacham, hopefully you don't feel so bad about falling inwards with Kokutsurachi. John Richardson, thank you so much. Os Martin. I think I'll end now, and thank you very much for your time and attention. Very much appreciated from Brisbane, Australia. Have a lovely time. Good night, and keep training. Os.